What I learned from Eolas as a service user attending the course was that I wasn't alone, that there were 7 or 8 other people in the room that had similar experiences that I had, and that we could learn from each other's experience.
Well, in the beginning, yeah, you know, it was difficult for me to tell. You know, it was all confidential, and we set out the rules, you know, and that atmosphere gave a good feeling to trust each other, and you know, and to have a basis where everyone can talk in the discussion, you know.
Eolas is a clinician and peer-led information programme for people with a diagnosis of schizophrenia and bipolar disorder and their families and friends. The purpose of Eolas is to provide information and to provide opportunities for people to share experiences and to learn from each other.
It was nice to be in a room with, I suppose, my peers, sharing information and finding out more about the illness that I have and the illnesses that they had.
When you're in a group where there's people who haven't been well, you know, you just don't even feel that you need to explain. They just kind of go, oh, okay, you know, like they know because they've experienced it. So you're not having to explain yourself to anybody, you know, which is great because, you know, it's just natural.
Eolas is a collaborative process which has been developed and delivered by service users and family members in a partnership with mental health practitioners. Eolas consists of 2 8-week programs. One is for family members and one is for people who have a diagnosis of schizophrenia or bipolar disorder.
They made it easier to come out, you know, to do a coming out, because I didn't tell to my wife, you know, before we got married. She never knew.
I would self-censor myself when I was discussing with friends or with family about my illness, because you don't want to scare people, you know.
As a family member myself and as the mother of a person who had mental health difficulties, what I gained was how very different the experience of being a family member or of having a loved one with mental health difficulties is for each individual. What we tend to do sometimes when we are living with mental illness is try to fix the individual, make it go away. And unfortunately that breaks everybody's heart. You don't make it go away, but what you do is you learn to live with it, and you learn to have a good life, and you learn to appreciate the person who suffers from mental illness in that as a part. The mental illness is part of that person. That's the full person, and you love that full person.
You know, one of the most meaningful parts of the Eolas group was dealing with stigma and you know, how to prepare for coming out and that.
You know, there's so much stigma attached to mental health and mental illness that it's nice to be in a room where you can discuss that stigma, but know that you're safe in discussing that stigma, and then being able to make decisions about how you feel about that stigma and how you feel about your life, you know. So that's really good, and that's a really good thing. That was a really positive part of my experience, you know.
You know, which I think is actually the hardest thing at the moment, because a lot of people need to be educated about schizophrenia or bipolar or depression.
And I think it's good. There's a change towards the perception of different mental health illnesses. There's a change of accepting people with mental health problems. Well, it's good. It's a good change, though. But still, I think there's still things to do, you know. Because I think people still, they are not comfortable to come out or to tell.
I also learned who was who, and in terms of what the role of each of the members of the mental health team were, and distinguishing between what the occupational health therapist was there for and what the social worker was there for, what the nurse and psychiatrist was there for. There's a particular module in terms of helping you to meet with the psychiatrist, to prepare for the psychiatrist, to make sure that the questions you have, that you get the answers that you need, and not to feel intimidated, because sometimes we can feel intimidated by medical professionals.
I suppose for me it was when I'm sick, you stop communicating with people, so you find it hard to be able to talk. So the 8 weeks gave me like loads of answers to questions that I would have been asking myself, or coping strategies, I suppose, with not being well.
I learned a lot about facilitating. The training was very good. It gave us a lot of confidence in terms of what was good and what wasn't so good in facilitation. Co-facilitating was excellent because I suppose you share the responsibility with another person, and we helped each other out in that area.
What I learned from facilitating the group, the person I facilitated with learned from how to get people involved. For example, to have an eye where the discussion might go, and especially when dealing with difficult situations, emotional situations, to give a break. For people where the topic is tough.
What did it bring up for me? It brought up the value again and the importance of listening to the service user. And while I would have always felt that I did listen, this really showed me how much I can learn in my practice from listening to people that are actually living the day-to-day challenges.
I think, especially those who were very distressed and who would have maybe had a diagnosis that was quite recent and would be in a lot of, suffering a lot.
I had some tough times, and by telling the people, what was tough and how I coped with this, and even though I had relapses, but still I managed to work, and I think that gave a positive feedback to the people.
They were able to see somebody who had experienced that, and who a number of years down the line was learning to live with it, and felt able to be part of a group and to facilitate a group like that, so that you could, all wasn't lost, and that you could be living a normal type of existence again, and a happy existence again, because I think there's one thing I have to give to it, is that I've become quite positive about what our lives are, and very grateful for all the positives that are in my life. And part of that is my son, and part of that is his mental illness as well, and that's part of our family life. And I think to be able to convey that sometimes can help others to accept that, life goes on, and it's not the end of the world.
One of the most enlightening experiences for me running the group and co-facilitating the group was listening to the experiences of people that live with daily mental health issues, describing their experiences that they have on a daily basis. Because I have years and years of experience as a mental health professional, and while I would have thought I understood what it was, the actual experience of sitting within that group and hearing these service users explain how they dealt with it, how they coped with it, was absolutely unbelievable.
And when I say making it real, is that I think that sometimes you have this thing about people in ivory towers. you know, and no insult to psychiatrists, but sometimes they are people in ivory towers because they have their experience, which is very clinical, very doctor, medical professional led experience of mental health, which is, don't get me wrong, it's a good thing. But I think if you have a service user facilitator, then they have the real life experience of it and can share that experience.
You know, this experience of you don't know what I'm talking about. How can you know what I'm talking about? And which I can't, you know, or a lot of other people can't. We can't know what it has been like for people down through the years with any sort of mental health problems, or caring for their family members with mental health problems. So by having the peer facilitation, it just, you know, it kind of helps this, you know, walk the walk. And listening to their stories, that it kind of gives you that greater understanding. And then, you know, for the participants, it gives that extra impetus kind of to, that it's not just the clinician coming in, you know, telling people the way they should feel or behave or respond.
In my experience of facilitating, because I facilitated carers groups, was allowing people to realise that, okay, my son or my daughter or my husband or my aunt or my uncle or whoever it is, the person that I love and that I care for, has got a mental illness. But, you know, so do I, and I'm okay. And, you know, with time and help, that person will, you know, will see beyond their illness.
One thing that I realised was that, and that I probably emerged during the programme, was that I needed to separate my wellness or my health from my son's health. And that if he was having a bad day, it didn't necessarily mean that I had to have a bad day as well.
I rang the nurse and I said, well, I'm going on a transatlantic flight, and, you know, how do I handle psychiatric medicine and 5-hour time difference? You know, and we had a very practical conversation, and it was very helpful. Now, that partly came out of my experience of having met the nurse on the Eolas course, but it really came out of having learnt about the medicine and, you know, trying to cope with that situation. And you know, I actually went into St. James's and I rang her the day before, knocked on the door, and we had a conversation about circadian rhythms and medicine, and it was very helpful, you know.
When we had a guest speaker in, we asked a lot of questions, and he answered a lot of things that, you know, I mightn't have had the confidence to ask my doctors, or might have felt a bit silly asking a question. And when questions were asked, you know, he was very much, you know, that's a good question, you know, no question was a silly question, you know, so I learned a lot from him.
You know, and I think another really positive thing about Eolas is that you find support groups forming after it. You find people make connections and they go, well, I'd like to see you again, and I'd like to see you again. And, you know, and they attend support groups, so they form their own support group, and they meet, you know, for example, one Tuesday every month or whatever, to help each other, you know?
Yeah, no, just, I suppose, I wouldn't say that there'd be one thing that, so there's so many different things that have got me motivated now with the Eolas programme. I enjoyed every minute of it, making friends and just learning about people's different experiences, learning how to deal with your sickness, but also coping strategies. So there's a number of things that have come out.
From a work point of view, I would have to say being involved in the Eolas, that it gave me that glow. I can't say enough about it. It's just been a fantastic experience. In a way, I've regret this wasn't here when I started my nursing career, that it's coming kind of more towards the end of my career rather than the beginning. Yes, it's just been wonderful. It's the best thing that I've done in my career so far.